Good evening, everyone. If you can find a seat, that would be wonderful. Good evening, and thank you for being here tonight. My name is Kim Schwartz, and I have the distinct honor of being the chair of the Foundation for Health, Leadership, and Innovation, and I get to MC tonight. So you're going to hear from me a lot. I'm sorry. I'll say that ahead of time. It is so nice to be here together for the 2025 Bernstein Event. I know every time I go into this space and see all of us, it fills my heart, because it's like coming to a family reunion. And I see folks I worked with 23 years ago, and I see somebody I worked with 2 years ago, and I see my former Bernstein alumni, and I see my health center people, and I see my hospital people, and it's like, oh, and it just fills that space, doesn't it? It's like a mosaic together, to be together, and to honor the work that we do together, and that we're going to continue to do together. So thank you for being here. You people who know me know that when I start a meeting, I do it a little bit differently than some others do. And so I'm going to extend an invitation to you to put both feet on the floor. Maybe lower your gaze a minute, and let's center in. Let's take some time to honor this space together. Take a nice deep breath in. As you exhale out, think about that air going out around your heart. Filling that up. On your next breath in, think about someone you love. Hold them in your space. Take that next breath in. As you exhale out, hold that wonderful, loving person there. Great job. You all just did heart math, a form of mindfulness meditation. Look at you. How do you feel? It's pretty good. The other thing that I do is I try to bring in what we call a third thing, something that will set the tone of the occasion that we're together in. And so I have chosen a poem. And it is a poem that I've known for many, many years. And a group that I work with now, Alidate, as a matter of fact, I'm a consultant with them. Their chief founder, Farzad Mashtarari, his mother taught him this poem. And it's called To Be of Use, and it's by Marge Piercy, and she was a school teacher. So you'll see yourself in this poem, so take a listen. The people I love the best jump into work head first without dallying in the shadows, and they swim off with sure strokes almost out of sight. They seem to become natives of that element. The black, sleek heads of seals, bouncing like half-submerged balls. I love people who harness themselves, an ox to a heavy cart, who pull the water buffalo with massive patience, who strain in the mud and the muck to move things forward, who do what has to be done again and again. I want to be with people who submerge in the task, who go into the fields to harvest and work in a row and pass the bags along, who are not parlor generals and field deserters, but move in a common rhythm when the food must come in or the fire to be put out. The work of this world is common as mud. Botched, it smears the hands, crumbles to dust, but the thing worth doing well done has a shape that satisfies clean and evident. Greek amaphoras for wine or oil, Hopi vases that held corn are put in museums. But you know, they were made to be used. The pitcher cries for water to carry, and a person for work that is real. To be of use. You recognized yourself, didn't you? And all of you in this room. I also want to take a moment to recognize some amazing folks who contribute to FHLI's success. And so you see their names up here. This is our board of directors, and this last year, the time that they've had to put in has been incredible in this transition. So you see them up here? And if you're one of our board members, will you please stand? They're going to be shy about this a little bit. We've got them spread out. Thank you. Thank you. And keep standing a minute. I want anyone who has been a former board member of FHLI to stand as well, please. Look at this. Thank you. Thank you. Thank you all for your commitment to FHLI's mission. And then we've got this incredible staff. Some of them are spread all over, but I want to acknowledge the staff. Would you all raise your hands, staff that are here? Some are in the room. Thank you back there. Thank you, guys. Okay, this is no understatement. Guess what? It's been a great year of transition. There have been significant changes in the federal and state government. I could use a slow news day. I don't know about you all. Here at FHLI, we've made some bold moves to adapt to this new and ever-changing environment. And along with the national search for a new CEO, you'll get to meet her in a minute, we've been working on a robust strategic direction for FHLI. This strategic direction emphasizes building trusted relationships with local communities, amplifying community voices, forming strategic partnerships, and implementing innovative models to improve health outcomes for the people of North Carolina. This plan will enable us to be more agile, innovative, and responsive, and as we work to improve health conditions so that all North Carolinians can thrive, you are an important part of this new, bold direction. Take a breath. We can do this. We know how to do hard things. North Carolina knows how to do hard things. Before we go much farther, I do want to take a moment of pause to remember a dear heart of ours, Dr. Joey Bell. I said I'm going to get through this, who passed away on June 16th of this year. Dr. Bell was the recipient of the 2024 Jim Bernstein Community Achievement Award. He was a beloved pediatrician and a cherished member of the Alumni community. A distinguished and pioneering pediatrician, he earned degrees from the UNC Chapel Hill School of Pharmacy in 1982 and the School of Medicine in 1986. Dr. Bell was both the first Lumbee and the first American Indian pediatrician in North Carolina. I will never forget his warm and courageous message to us all that evening he received his award. We will continue to honor him and remember the gifts of healing, advocacy, and transformation he shared throughout his life. His legacy and influence on North Carolina will endure forever. And our thoughts are with his family. I don't think Ronnie's here tonight, but our thoughts are with his family. I would also be remiss if I didn't recognize that 2 weeks ago we acknowledged the first-year anniversary of Hurricane Helene. My husband and I just had moved to Boone 3 weeks before it happened. And after nearly 20 years in eastern North Carolina, I thought I knew what to expect of a hurricane. Boy, was I not right. So much left unprecedented devastation in its path. And over the past 12 months, we've seen and heard incredible stories of neighbors and communities stepping up for one another, finding strength together in the face of all the challenges that come with a disaster of that magnitude that I had never seen. This year, we're introducing a new Community Impact Award to honor some of the outstanding health leaders who have made an incredible impact in their communities during Hurricane Helene. We also have another award this year. We've had this in the past, but it's been quite a long time ago, but to honor our Bernstein Fellowship alumni. So we're going to have 2 awardees this year. And our Bernstein alumni are the emerging leaders that improve health and well-being across North Carolina. It was created by our founding director, Jim Bernstein, and this program builds on his legacy of leading statewide initiatives to support community-driven care in rural and underserved communities. Bernstein Fellows carry on Jim's mission by promoting community-driven solutions that improve whole person, whole community, whole state health. Over the course of the 2-year program, fellows enhance their collaborative leadership skills through educational activities and project development. Fun fact, 90% of the Bernstein Fellows of the last 30 years still live and work in North Carolina. Will my alumni please stand? So I also want to introduce you to our current fellows, which we got to hear their presentations earlier today. Every year I say, well, no, this is the best one. I whisper into all my grandchildren's ears, you're my favorite. So I have 7 of them. So So I'm going to ask them to stand. Shanika Brightwell, Tanya Bryant, Matt Mitchell, who's sick, he's not with us, Kayla Price, Liz Stevens, and LaCasa Timpton. Thank you, guys. Oh my gosh, thank you. Yeah, I know most of their bosses, and two of them were in the room. So I took pictures of their presentations and texted them, Tim. I sent them on. You got this. You got this. All of these fellows are an essential part of Jim's larger legacy, which we're here to celebrate this evening, as you all know. A legacy of community care and collaboration that ensures everyone in our state can access health and human services. Lastly, we're here today to honor have new awards for health leaders and to celebrate the causes that unite us all. You know what this is. Envisioning a healthier future and rallying together, holding hope in our hands and in our hearts and in our communities across our state to turn that vision that we have into a reality. That's what we do. So that's exciting. So tonight, we are fortunate to have the support of so many generous sponsors. Look at this. How about that? That's pretty impressive. A special thank you to our sponsors, our silver sponsors, Community Care of North Carolina and Molina Healthcare, and our platinum sponsor, Aetna. But I would like everyone who's sponsored, if you'll stand, if you're here, if you'll please stand, so we can acknowledge you. Yay! Look at this! Thank you so much. And with that, I do want to welcome our platinum sponsor to the podium, Nicholas Duran, who is Aetna's Medicaid Executive Director of Business Development. We were just talking about our nervousness of all the travel, and so Nick, thank you for being here.
I love that music. It goes well with the centering exercise we all just did as well. Good evening. It's good to be with everybody. We are very proud, Aetna, to be a sponsor for this evening's event. And if you kind of take into account and you look at Jim Bernstein's legacy and why we're here, right, the idea of coming together, collective impact, bringing folks from all sorts of different strokes and worlds and lives to really kind of take on the challenges, particularly in our healthcare and in our access to healthcare space, is really commendable. So today we get to celebrate some really important people. So I'm not least of those individuals who really get to kind of come up here to the mic to be celebrated. However, you know, Aetna, I wanted to kind of talk just a few seconds about us. One, from our history here in the state, we've been over 125 years as a company and a part of the state. So we're residents, we're part of this community, we're thinking about these access issues and other issues in general. And so I think that's one thing. And the other thing, and I would say it because if not, my colleagues will come after me later, we also have the honor to be the state health plan in the state, and next week's open enrollment. So if you have any questions, I'll send you to my folks who are here. I come from our Aetna Medicaid line, and if you think about Medicaid in this day, I mean, obviously there's a lot going on right now and what we're talking about when it comes to Medicaid. But as an organization, we serve in 15 different states, over 3 million lives. And I say that we do that because it comes back to the idea that we have all these different experiences of what that means. But in the end, if you look at our team, we are a team of people who are very passionate about Medicaid. Medicaid is a bunch of lives of individuals who are having a hard time making their ends meet. And we have to every day think about how do we make that better? How do we be a part of making their lives, move the needle, the metric on their lives in that space? And what it really, really requires is us to have lived experience. So our team is made of people who have lived experience and understanding what it means to be in Medicaid. But it also requires us to be very humble in knowing who and what we need to know, but more importantly, surrounding ourselves and being a part of listening and learning and getting more empowered by the folks who are also surrounding and providing those services to folks. So I say that in the spirit of what we're here to talk about, celebrating, bringing together, working on hard challenges where we know in this state and this day and age today, you know, at the Fed level and down, we got a lot of things that are a lot of challenges to meet on that end. But in that space, just know that Aetna, in this state, We work across the state. We're working with all sorts of partners. I see a lot of friends in here who have opened the door and said, Nick, I'll give you a couple minutes and are willing to work with you. But that's in that spirit. We're here to be a part of that conversation and be a part of that table. And we can support that and see the work that others are doing. So being a part of this organization today and being here to celebrate, Dr. Kiever, thank you, and the rest of the foundation and the board. We're really, really just honored to be here this evening to celebrate. Thank you.
Thank you, Nick. Nice job. And we're really looking forward to working with you in the future and excited about open enrollment. We've got things happening. My husband's a state employee. We got it going on. Listen, this is one of the sweetest things for me to be able to do. I get to introduce you to our brand new CEO and president. She started last week. This is her second week on the job. I do want to take a minute and thank, we had a committee that did that transitional search group together, the board and staff members, and many of you in this room were a part of our extensive search process and interviewing. So thank you, those of you who did that with us. And Armstrong McGuire, thank you so much. Mindy, I don't know where Mindy is, but thank you, Mindy. You did a fantastic job. So I can promise you it was a comprehensive and collaborative process that we made this selection of Dr. Rachel Kiever. Dr. Kiever is incredibly well suited to lead these efforts. Now get this, it's going to blow your mind. She was a North Carolina Rural Health Scholar under the leadership of, guess who? Jim Bernstein. How about that for continuing to carry on the legacy in this new role? Dr. Kiever is also an accomplished physician with a dynamic career spanning community-based care, nonprofit leadership, industry innovation, academic medicine, and public policy. She's a longtime advocate for whole person health and brings a deep understanding of North Carolina's health landscape. We have asked her to share a bit more about her background and passion for this work. Please join me in welcoming Dr. Rachel Kiever, President and CEO of FHLI.
Wow, I wish you could see what I'm seeing. Good evening. I want to extend my heartfelt thanks to Kim, to the FHLI board, and staff, and to all of you here tonight. It's an honor to be here. As I embark on this new role, I'm deeply impressed with the dedication of our board and staff. Like a lot of people in this room, their unwavering commitment to supporting whole person health across our state is truly admirable. In my glory days at the University of North Carolina at Chapel Hill School of Medicine, a bit down the street, I was naive enough to respond to a flyer on a billboard and met a man named Jim Bernstein. I was fortunate to be a North Carolina Rural Health Scholar, and during that time, I got to see a part of medicine that I might have never seen if he hadn't introduced me to it. Tonight, his family is here with us. Sue and Eric Bernstein, could you please stand? I told Sue earlier that when you're a hungry medical student and people invite you to their house and feed you real food, you never forget that. Thank you. Jim used his energy and his relationships to create solutions. He arranged for me and a handful of willing and naive students to have real-world experience in rural environments and in migrant health. That exposure shaped my understanding of what it meant to advocate for health in my role as a doctor. That kind of care didn't observe the boundaries of the clinic doors. What I realized from that experience is that I could use all the technology in the world in my role in cardiology, and it's fantastic. But what I felt about modern episodic care is that it missed the opportunity to realize the full potential of health. What I'd like to see is that guideline and policy change can be formulated into a medicine, an elixir for all of us. Building on the solid foundation of the people in this room, of what is now FHLI, I share with you this aim to create the conditions of health so that all people in North Carolina can flourish. With that shared and lofty goal in mind, I'm here to deliver a few words of encouragement and maybe a hint of direction to the amazing professionals in this room. I want to share with you what I think will help us be involved in promoting the conditions of health and in the delivery of health care. I want to remind us that we hold the knowledge, we have the power, and that we bear the responsibility. I also want people to remember that we're only as strong as our most vulnerable members. I ask that we refuse to be saturated, marinated, or degraded. Engage in mutual aid. Think about the people in this room that have helped you. Go home and do that for someone else. State the truth. Repeat it frequently. From Marcus Aurelius, he asked that we concentrate every minute on doing what's in front of you with precise and genuine seriousness. Do it tenderly, willingly, and with justice. I ask that, as tempting as it is, that we refrain from draping the outrageous with our attention, that we break the cycle of algorithmic award, that we remember that children matter, that we understand the incentive structure that is driving an unwanted outcome in our area of expertise, that we don't fall prey to fixed human behaviors. The click-run algorithm in our animal brain that served us in the wild should not be employed on the internet, and it has no role in modern community building. We all need to be seen and belong. Build your village of positivity and look for those who still need a village. Investigate and embrace uncertainty as an executive skill. Become a seasoned change maker. On the worst days, know that joy can disarm threats and affirm our own humanity and the shared humanity of those in our community. And mostly, I want to remember that we in this room have the power, the knowledge, and the responsibility to create the conditions of health in North Carolina. I am so excited to share the knowledge that I've gained over years of experience to support FHLI's mission. This vision for a healthier North Carolina, to walk alongside communities and address our health challenges, is totally the best job I will ever have. As Kim mentioned, we have a new strategic direction that's been approved by our board of directors. I look forward to sharing it with you and our partners across the state in the coming months. I will need your support, and I'm going to come ask for it. Remember, we have the responsibility, the knowledge, and the power to create these conditions of health. Let's do this work with joy and precision and in community. Thank you. I'm going to take a moment of personal privilege to wish Dr. Karen Smith a happy birthday. I also want to say that this is not the first birthday that we've celebrated with Dr. Smith at a Bernstein event. So it keeps, every 7 years, it keeps coming around. It is now my privilege to introduce Dr. Skip Cummings. He's going to present the Jim Bernstein Community Health Career Achievement Award. Skip is a current Burbecker Distinguished Professor of Rural Medicine at East Carolina University. He's the co-director of the eCare Practice-Based Research Network and a senior faculty member at the ECU Disparities Center. Skip was also the recipient of this award himself in 2023. Please help me welcome Dr. Skip Cummings.
Good evening, and thank you for being here. What a wonderful evening. It's great to see everybody together. I have the most exciting task tonight. I get to introduce Dr. Cunningham as the Bernstein Award recipient this year. So Dr. Paul Cunningham is a distinguished Jamaican-American surgeon and medical educator. He started his medical career earning his medical degree at the University of West Indies, and then traveled to New York and completed his surgery residency training in New York. He then stayed and worked in a surgical practice there in the Bronx VA and at Elmhurst Hospital, and then saw the light and moved to North Carolina, but not to a swanky metropolitan practice. He moved to rural Bertie County, North Carolina. Okay? My friends, that says volumes about this man and what his priorities are. While in Bertie County, he began to meet medical students from ECU and learned to love medical education, and eventually transitioned and became part of the faculty at ECU Brody School of Medicine, and was promoted through the ranks to a tenured full professor, and left a tremendous legacy in terms of medical education and access to care. He left for a period of about 6 years to become chair of the Department of Surgery in upstate New York, and then returned to be dean of the School of Medicine at ECU, again, bringing his unique leadership skills to our institution and to our region. He served as dean for 8 years and subsequently named Dean Emeritus in 2016. And I also note that he's received several important awards, including the Presidential Award from the National Medical Association, the Order of the Longleaf Pine from the Governor of the state of North Carolina, and the Jacoby Medallion from Mount Sinai School of Medicine. 2 other things I want to tell you about this man. This man has a huge heart. He has a heart that is filled with compassion and caring, and that spills over into his relationship with patients, with students, with faculty, wherever he is. It's wonderful, and it created a real culture at our institution. Secondly, I want to tell you that he thinks deeply and writes well, but he also engages really well. So he has been purposeful and intentional in terms of listening for the community voice, hearing the perspective of people throughout the state of North Carolina, and bringing those perspectives together in his decision-making, both in local organizations and across the state of North Carolina. And so it's with distinct honor and pleasure that I want to ask Dr. Cunningham to come up. Please join me in congratulating Dr. Cunningham as the 2025 recipient of the James Bernstein Community Health Career Achievement Award.
It's heavy. Professor Cummings, I think you've blown my cover, and I apologize. Board Chair Kim, thank you for having me here tonight. President Keever, for your inspiration and your continued leadership. We're here to be of total support of you. I'd also like to make sure that everybody else who is here tonight who has been recognized this evening is worthy of several more awards. So friends and colleagues, this has been a completely unexpected and extremely meaningful honor. To be acknowledged by this organization that is so committed to improving the health and well-being of communities across North Carolina means more to me than I can truly express. I could possibly take this, though, as a sign. It's a miracle. It may mean that somehow, beyond all expectation, I've made progress in meeting what Forrest Gump would have described as my purpose. Given sufficient time, he had a different connotation. Given sufficient time, I would really like to spend most of this time paying homage to all of those who more deservedly received this honor before me. But I was told that I would only get 5 minutes, or else I'd get the hook. But I don't want this to be all about me. Have you noticed that without fail, every obituary written in the newspaper indicates that the dear departed loved one is destined for heaven? Have you ever seen an obituary that says otherwise? No one has ever made a wrong turn. It's the same tradition with biographical sketches and formal introductions, Skip. And my dear respected colleague and friend, the Birbecker Distinguished Professor of Rural Medicine, Skip Cummins, closely adhered to the hyperbolic tradition this evening. Thank you. But really, seriously, I may be able to convince myself that this recognition is a trustworthy sign of having achieved some success. Who am I, though, to really make the judgment? How should we really measure success in both our personal and professional lives? My own experience as we progress through life becomes more difficult to measure achievement. For me, at one time, though, it was very simple. All it took was that a few of my patients successfully survived my surgery. Just some. But more rationally, in final analysis, it may have been more to do with achieving a preconceived purpose. I could offer that our purpose is what we promised to people who we respected, loved, admired, and trusted throughout our lives. For me, a short list of those people would include my grandfather, who I really revered, my mom, for ambition, my many mentors, and my trusted friends and colleagues. Many of you, unfortunately, came tonight. It is therefore a relief that someone like my trusted colleague and friend, Skip, was able to embellish the truth convincingly enough to be believed. Finally, in my life, there is one who tells me every day that she loves me and convincingly attempts to make me believe that I've made some incremental progress in accomplishing my purpose. She's my loving wife, Sydney. She may be a little biased, but I tend to believe her most days. Thank you so very much.
You better take this. Oh, we could tell you stories. Those of us in Eastern North Carolina could tell you Dr. Paul Cunningham stories. We'll save that for the reception afterwards. There we go. And wasn't I right about Dr. Kiefer? Told you. Told you. Okay, so historically, we've only done a second award that we called the Community Achievement Award. So this year, we decided that as a board, that what happened in Western North Carolina last September really needed to be honored. And so we have a new award called the Community Impact Award to recognize those of our partners who stood by the people of Western North Carolina, going above and beyond, not seeking recognition, but moved by a deep commitment in response to the healthcare needs of their communities and people in crisis. These 4 individuals jumped in without hesitation and tirelessly responded with their particular skills and compassion to the devastating impact of Hurricane Helene. You know this, More than 100 people lost their lives. Over 73,000 homes were impacted, with many sustaining severe damage, and 145 health facilities were evacuated, disrupting access to care. The storm changed more than just the landscape, my friends. It had lasting effects on physical, mental, and emotional health for individuals, families, and communities. To be honest, we could have honored so many Western North Carolina healthcare professionals who carried on providing care with no power, no water, and very few supplies, wherever they could, whenever they could, even when they themselves experienced devastating losses. My other board members made me limit it to 4. It's their fault. I had the honor of contacting each of our awardees, and not surprisingly, they all expressed that they did not deserve this recognition. Give it to someone else. All 4 of them said that. I'd like to ask our 4 awardees to come up. Stand right here while we honor you. Get the music even. I love that music. So, it is my honor to introduce our first awardee. I apologize for reading this, but I don't want to leave out the details because they're so important. Our first awardee and recipient is Dr. C.J. Atkinson. C.J., you want to step forward? You get to step forward. Just like His courage, compassion, and commitment embody the very best of service in the times of crisis. Dr. C.J. Atkinson has shown us what it means to do the right thing, even when circumstances seem impossible. When Hurricane Helene devastated Western North Carolina, C.J. drew on his background as an Army physician with experience in mass casualty situations and immediately stepped forward to help. With his Novant Health team behind him, he partnered with Buncombe County officials to ensure that care could reach those in the most isolated and hardest hit areas. In those earliest hours, with no power or communications and only 1 oxygen tank for dozens of patients, Dr. Atkinson and his local paramedics improvised, rotating oxygen, powering equipment with car batteries, and bringing stability to a community in chaos. From delivering critical medications across the mountains to helping a mother safely bring her baby into the world against all odds, to standing side by side with first responders and community members for weeks after the storm, Dr. Atkinson never wavered. His efforts, supported by his team at Novant Health, which he insisted on us naming, Andrea Flynn, Dr. Stan Fuller, Dr. John Mann, Elizabeth Alton, and Dr. Pam Oliver, along with FHLI and an entire network of local partners, made an immeasurable difference to families who lost so very much. Dr. Atkinson, thank you for your steadfast commitment to the people of North Carolina and to exemplifying the highest standards of needs during its service. You could stand up there for the rest of it. We told you it was heavy. There we go. Our next awardee could not be here with us tonight because you all know why. She is always on the road. Dr. Shannon Dowler, always out and about. And she would be here with us except for her obligations as a board member of the National Academy of Family Physicians. But we have her son here with us. And Jacob is going to accept her award. So you get to step forward and get her embarrassed. There we go. Dr. Dowler is a family physician in Madison County and a national leader in public health, sexual health education, and advocacy. Her leadership has been felt nationwide and throughout our state. And I will never, ever forget her fireside chats during COVID. Will any of you? Yes. As it is often in moments of crisis that true leadership shines the brightest. After Hurricane Helene devastated her community, leaving families without power or water, as we talked about, Dr. Dowler, alongside her sister and brother-in-law, immediately set up a generator at their local rural cafe, providing free meals 7 days a week Next door in a garage, they created a first aid and emergency supply station, sustained by donations from neighbors and strangers from across the Southeast. As she described it, every day for 3 weeks we offered assistance, and every day cars and trucks, many with out-of-state plates, stopped by to ask what we needed and stocked our shelves. Whenever those shelves emptied, the kindness of strangers refilled them. We'd like to honor Dr. Dowler with this steadfast, again, service to our state and for leading with care, resilience, and heart when it is needed most. I'm going to make Shannon take a picture, though. Thank you. Finally, we recognize you guys step forward, come on. Finally, we recognize two extraordinary individuals whose compassion, I keep using this word resilience, but it just works, and leadership helped hold a community together in the aftermath of the hurricane. Steve and Amanda North stepped forward with their neighbors when they needed them most. Though their own home was spared, and I was there, but literally across the street, a car was on the roof of their neighbors. It was so close. Bridges were washed away, medical clinics were destroyed, and Mitchell County lost all cell and internet service for 4 long days. In the midst of that silence and devastation, Steve and Amanda became anchors for care and hope. Steve, a dedicated family physician, coordinated medical volunteers, military medics, physicians, nurse practitioners, and others, ensuring that patients with urgent needs and chronic conditions alike could be treated, even when the local health system was down. Amanda, who leads a healthcare nonprofit, opened the doors of their house to feed their neighbors who had lost their homes, as well as volunteers who came to serve. She organized medical supplies, pouring into the county, transforming a former school into a hub for distributing resources with care and stewardship. Together, they supported clinics in Mitchell County by providing care to remote communities, especially Beulah Dean and Tipton Hill, and offered stability to those living through chaos. Their work was not only about immediate relief, it was about restoring dignity and health and connection. Now, Steve and Amanda used social media to recruit providers for their clinics, and I worked one Saturday with a group of doctors from Maryland who came down. As a mental health therapist, I was most useful walking around the community center, checking in and helping out where I could. One of the volunteer coordinators asked me to check on one of the ladies in the cafeteria. I'll call her Libby. She had worked every day for the last 3 weeks from dawn to dusk and was not sleeping. As I went and got my lunch, I asked her how her nights were going. And she said, well, not so good. I just keep waking up and hearing that wind, and I get so worried. And then I told her about 4 square breathing, and thankfully, the other sweet cafeteria lady said, I know about that. Dr. North told me about that. Then I sat down with my new friend Libby to eat my sandwich, and she told me this story. She said, about 5 years ago, a young guy moved into the house right behind hers, and she knew he was a sex offender, and she couldn't figure out how she was going to get acquainted, so she never had. And then the storm came. All the trees were down. They could not get out. He came out, the chainsaw, cleared all the trees, cleared all the path, took all the things away that were impeding them getting out. She said, now we're acquainted. Even today, the challenges in Mitchell County remain. Families are still living in campers. Children continue to carry the trauma of what they saw and heard. And yet, week after week, Steve and Amanda continue their work, healing patients, supporting families, and reminding their neighbors they are not alone. In their humility, and they will tell you they were just a part of the many people who stepped up. We shine a light on you tonight, and thank you. It is an honor to present this award to you, Steve and Amanda, for all that you have done. Thank you. Listen, let's give a big round of applause for these awardees. I made it. I thought I was going to cry, but I got through it. And now I'd like to introduce my dear friend Hugh Tilson to present the Bernstein Fellows Legacy Award. Everybody knows Hugh. He's the executive director of the North Carolina AHEC and a dear friend and trusted partner of FHLI. He's been so generous with his time for many years, working with the Bernstein Fellows Program, volunteering his time to be the co-leader and guiding these young fellows through their time. They know. Everybody's in love with you, including me. Hugh Tilson.
My wife is.
She is, for sure.
Good evening, everybody. I've had the best volunteer job in the state for the last 7 years, and I just love it. It fills my cup every time I get to see the great work that the fellows do, so thank you for the real honor and privilege of being able to do this. I'm excited to present the Bernstein Health Leadership Distinguished Alumni Award tonight. It's new, it's exciting. Before I do that, I'd like just a couple seconds of gratitude. I couldn't do this without the amazing work of the FHLI team. So Chet, I've really enjoyed your leadership, your friendship. Thank you so much. We've really done some good things together. Thank you. And of course, none of this happens without Lisa Tyndall. Lisa is the magic behind all of this. Nothing happens without your amazing coordination and just the way that you have helped us to create the collaborative spirit and culture that we get to do it's just a reflection of you. So thank you so much for that. You've already recognized the fellows, so thank you guys for being here. Thank you for saying yes when we asked you. And for all the alum, thank you so much for all that you do all day, every day to help North Carolina continue to grow and succeed. And I also want to thank all of you for your generous contributions. I get to see how that money is spent as we help our fellows do their work. So thank you so much for being here tonight. I know you could do all kinds of things with your money and your time. I promise you it is money well spent. So thank you so very much for that. This is a new award, and it recognizes graduated Bernstein Fellows who exemplify the values lived by Jim Bernstein. Everyone has a right to care. Care should be delivered in a respectful, efficient, and effective manner. Healthcare belongs to the community it serves, and successful healthcare organizations are led by talented, dedicated, and well-trained leaders. I get to introduce two of them tonight. There are many here, Schell McCall and Weyling White. Schell, if you come on up. Nice things about you. So Schell McCall serves the Executive Director of Partners Aligned Towards Health, PAAFP. It's a nonprofit organization addressing critical needs such as public health, youth mental health, food security, and substance use in Mitchell and Yancey counties. Every program of theirs is a collaborative effort with community members and stakeholders aimed at improving the overall health of their community. FHLI has a shared goal of reaching out to local communities, develop meaningful partnerships, and is proud to recognize Schell for that alignment. Her work earned national recognition during Hurricane Helene response, where she co-led an inclusive grassroots relief effort, and she is known for leading with authenticity and integrity. She continues to inspire the next generation of leaders in rural health. Schell, thank you. Mayor Weyling J. White is a nonprofit executive, public health leader, the first African-American mayor of Ahoskie, North Carolina. His commitment to and love for his community ran deep. He was born and raised in Ahoskie, graduated from Hertford County Public Schools, and served as Ahoskie's mayor since 2019. As mayor, he champions economic revitalization, violent crime prevention, and youth empowerment, while also addressing many other local needs through initiatives, policies, and advocacy. Throughout his career, Mayor White has assisted hundreds of uninsured patients in Hertford and Berkeley County in accessing free and or low-cost care. He and his team launched the TRIP program, offering free transportation to medical appointments in the Roanoke-Chowan area, which has been highlighted in UNCTV's NC Impact. FHLI commences efforts to address social drivers of health in your community. In 2017, Mayor White was nationally recognized as an emerging leader in healthcare transformation by the Communities Joined in Action. His public health work earned him appointments to the North Carolina Institute of Medicine and the Bernstein Health Leadership Fellows in 2019, the first class I got to lead. He's also a graduate of both Rural Economic Development Institute and Leadership North Carolina. He currently serves as a board member for the North Carolina Rural Center and North Carolinians Against Gun Violence, in addition to being the chair of the Hertford Health Maintenance Alliance. Please join me. Oh, that's it. That's it. That's enough, isn't it? That's it. Thank you, guys. Please join me in congratulating Schell and Weyling as the inaugural recipients of the Bernstein Health Leadership Distinguished Alumni Awards in recognition of their work in creating the conditions for health so that all people in North Carolina can flourish.
Nice job.
Thank you.
We're just a few minutes behind. We're doing well because we got dessert coming and a few more beverages if you'd like. So we're nearing this time together to end. And I just want to say, look around this room. Just take a minute. Look around. Just amazing, amazing people doing amazing, amazing things and inspiring all of us every day. And I'm going to say, this is why we do what we do. This last year's been a little tough thinking about this change, and we had to, as a board, think about the relevance of FHLI and what we need to carry forward and the legacy and the work. And we worked hard at that, didn't we, board? It was hard. And we had to say, this is what we're willing to step into and do. We're taking this on together. We're about whole person health. You've heard that all evening long. By connecting local needs with available resources, we're here to support meaningful and lasting positive change. We know that communities are the true experts on the challenges they face and how to address them. This understanding will guide our engagement together with local leaders as we co-create real solutions. And we have our work cut out for us. And we need you. So get your phone out. Got your phone? Get your phone out. You all know this if you've been here before. I want you to send a text very quickly to someone that you know that's in your list that has influenced you positively, and you want to say thank you. All you need to do, just take 1 second. That's all we're doing. Now, you might get some weird texts back saying, are you dead, or what's going on? Is there something happening here? No. Just say, I just wanted to take a minute to thank you for how you have helped me and influenced me. Yeah. I don't know whatever meeting you ever go to that they tell you to take your phone out. It's a good practice. I do this every Wednesday. Those people who know me, they get a Wednesday every now and again text that say, I just want to remind you. So we happen to be here on Wednesday. So that's what we're doing. Taking a moment to thank somebody that has made an influence. Thank you. Thank you. Now, you've got your phone out. Pull your program out. Look right here. You see my evil plan? Take a picture of this, and you can connect to FHLI. Make sure we have your information, and you can donate if you'd like. You got it right there. It's right in the program. Or it's on the table as well, too. I am getting some of the sweetest texts. Thank you, people in this room. You're making me cry. I was going to get through this. So, as we close together, I just want to say how meaningful it is and how important it is, the work that we're doing. And it has ripple effects. You never know, do you? You never know where your seeds land. So I'm going to tell you one more story. So we just moved to Boone, and it was after the hurricane, and I'd found a nail salon. I'd love to get my nails done. And I didn't even make an appointment. I just bopped in, and you're like, where's she going with this? You'll see. And this is nowhere near campus. So I live in Boone, and my husband teaches at App State. This is nowhere near campus. And I get done, and I see this young lady come in, and she has ECU sweatshirt on. And as I'm checking out, I say, hey, are you a pirate? And she said, well, yeah, but I'm also right here in Boone. I went to undergraduate here in Boone and my graduate school, and now I'm in dental school at ECU. And I said, oh, how cool is that? And I said, are you at one of the Service Learning Center sites? And she goes, how do you know about this? I said, well, I had something to do with getting the first one started in a Hosky. She said, a Hosky? That was my first choice. I didn't get to go there. I'm like, oh, okay. And she said, I'm at another site. And but I said, oh, yeah, I know all the folks over there. And I mentioned their names. And they said, who are you? And I said, well, my name is Kim Schwartz. You would know me, but I live here in Boone. And she stopped. And she said, I know who you are. And she said, thank you. Because I could get into ECU Dental School because I'm a North Carolina resident, I'm going to come home right here back to these mountains where I was raised, and I'm going to practice dentistry. Now, I could hardly speak after that moment. I went out to my car, and I had a few tears. And I'm like, because I was feeling kind of, oh, what am I going to do here in these mountains? What am I going to do? But you never know where your seeds will land. You never know. So think about what you're planting these days. Think about what's happening. You may never know. Fluke, you may never know. So that's the work of what we do every day here in North Carolina, making our lives better, the people better, and what we do better. So before you head out, I want to remind you that we have a special dessert reception for all of you in the atrium, and so please take a moment to visit with our awardees and get to know them and congratulate them and our fellows and our alumni and spend some time together. And we hope that this time together has inspired you in this day and time when we need all the inspiration and hope that we can get to do more for our people that need us the most. So thank you all, and good night.